Good afternoon. Thank you for joining us today. My name is Sarah Wolford. I am the Efficiency and Sustainability Officer for Carilion Clinic, and this is Harris-Boush. He is our Community Outreach Manager, and we're here to talk to you today about how we at Carilion are using the Healthier Hospitals initiative to create a healthy environment for healthy communities.
A state and a region, we are facing significant health challenges. In order to improve health, we must have a broad community conversation that focuses on where the system could be failing.
In some ways, I think a new way we're thinking is how to collaborate with many different organizations to look at the whole diversity of our region and strengthen relationships so that we're not replicating efforts, but rather we're complementing.
One of those investments is the Community Health Needs Assessment that's done in 6 different areas, including the Roanoke and New River Valleys, Franklin, Giles, and Tazewell counties, and the Rockbridge area.
It allows us to fulfill our mission, which is to improve the health of the communities we serve. If we don't have the data, we don't know whether or not we're doing well, whether or not we're making the impact that needs to be made.
So, through the Community Health Needs Assessment, we look at holistic health, including the determinants of health. When looking at what makes us healthy, access to healthcare equates to 10%, genetics 20%, and the environment 20%, and healthy behaviors 50%. But when we look at what we spend on healthcare, we spend 88% on medical services, 4% on healthy behaviors, and 8% on other factors, such as the environment. And at Carilion, we do not think that we can achieve our mission of community health improvement alone. We partner with hundreds of other agencies to address community health using the collective impact approach. This approach focuses on evidence-based decision-making, relationship and trust building, common goals, and shared strategies. Addressing the problem from a cross-sector approach leads to large-scale social change.
So one of the problems that we at Carilion are looking at, along with our community partners, is the issue of environmental health. Hospitals and health systems in the U.S. use 8% of the nation's energy, and the infrastructure that delivers energy and water to our hospitals and to businesses is heavily reliant on fossil fuels, the byproduct of which emits toxins such as arsenic and mercury and particulate matter, which negatively affect human health through the air we breathe and the water that we drink, and are linked to premature mortality, chronic bronchitis, asthma attacks, and other respiratory symptoms. But environmental health is not just about clean, healthy air and clean, healthy water. It's also about clean, healthy food. And lack of access to healthy food directly impacts an individual's and a community's ability to purchase fresh, local, healthy fruits and vegetables and whole grains. So the whole picture of sustainability and environmental health is what we are intentionally looking at within our facilities and with our community partners.
When we started looking at data around environmental health, we found that county health rankings ranked the city of Roanoke 115 out of 133 counties in Virginia, with 133 being the worst. We also found that 38% of the population in the city of Roanoke live in food deserts or have low access to supermarkets. So while we address a lot of other healthcare needs throughout different collaborations, we really decided to focus on environmental health. With Carilion's large footprint, including 6 hospitals and 220 outpatient facilities, and being the largest employer west of Richmond, we felt that Carilion has a great potential to impact environmental health in the region, not only through our own facilities, but through engaging the business community to work towards a greener community.
So given our scope, that footprint that Aaron was just discussing, we are acutely aware that our decisions matter. What we purchase matters. The resources we consume matters. They affect our communities within our facilities. And what we found were a couple of things. Number one, we had some really amazing programs in place. We had the Reusable Sharps program that has diverted 754,000 pounds of plastics from Virginia landfills and saved our healthcare system $615,000 to date. We've been doing lighting retrofitting to LED in our hospitals, in our practice centers, in our garages, and in some areas we're only using 8% of the energy that we were previously using. In our emergency department at our flagship hospital, We did some switches to more environmentally preferable products. We switched from disposable to reusable pillows and pulse oximeters. And now we're enjoying a $273,000 a year savings, and we're diverting an additional 12 tons of waste from our waste stream every year. So we had this picture, but a couple things came really clear. Number one, in our facilities, these projects were happening in pockets and in silos within our own organization. So we had some really wonderful things happening here and there, but we weren't systematically working toward any common goals. Number two, no one knew about our good works. Our employees didn't know, and the public didn't know. And number three, we were not doing anything. There was no links to the community when we looked at environmental sustainability. So we came up with a couple of recommendations, and the one thing that we knew that we needed was a formalized work structure within Carilion to encourage accountability and leadership engagement in order to capture, celebrate, and highlight our good work. And the second thing that we knew we needed to have was collaboration beyond the walls of our facilities to reduce silos and foster relationships with the community with the specific goal of improving environmental health for the region. And with those two things, these would lead to strengthened efforts and outcomes. So what do we do? Here was our action plan. Number one, we restructured our Green Team Steering Committee to form an Environmental Stewardship Council with more leadership engagement and a more specific structure. Number two, we dedicated a full-time resource to this program when we created my position of Efficiency and Sustainability Officer. We are so overtaxed in what we do every day just to keep our business going that we knew we needed one person, boots on the ground, to keep these initiatives marching forward, or we would have a lot of excitement and they would all get started and then they would drift down. Number three, we looked out into across the country to see what frameworks and models were out there, what was already available to us, and what we found was the Healthier Hospitals Initiative. The Healthier Hospitals Initiative is a guide for hospitals to reduce energy and waste, to choose safer, less toxic products, and to purchase and serve healthier foods within their facilities. It provides proven frameworks and implementation tools to guide our efforts in environmental sustainability, and one of the greatest things about it, it's a free initiative. It came at no cost to Carilion. It was developed by 12 of the largest US health systems. And the challenges are a data-driven platform designed to commit to sustainability goals and track our environmental efforts. The challenge areas are engaged leadership, healthier food, leaner energy, less waste, safer chemicals, and smarter purchasing. So once we enrolled in the Healthier Hospitals Initiative, in order to solidify our commitment, Carilion leadership signed the Healthier Hospitals Executive Commitment Statement. And what this committed our leadership team to and our organization to was creating a comprehensive program of environmental sustainability, to integrating sustainability into our core business strategies, to establishing sustainable, measurable goals and objectives, and to tracking and sharing our results with our employees, with the public, and on a national platform. We created a usable framework and reporting structure for our work in environmental sustainability based upon the commitments made through the Healthier Hospitals Executive Commitment Statement. So what we did was we created a work structure, and then we created the Carilion Clinic Environmental Stewardship Council. And the way that this works is we have an oversight committee of the senior vice presidents and vice presidents over the pertinent departments that meet biannually. And their role, they meet biannually, and they meet with the senior directors of pertinent departments to help us set our goals, and then we meet back in 6 months so that we can update them on where we are and so that they can hold us accountable for our work. Below the oversight committee, we have 6 work groups that meet monthly, all based again on the HHI challenges, and for each work group we have a VP sponsor of the pertinent department. And that person is there to help us keep marching forward and to help us cut through some of the red tape that we come to. If you look here on the end, the last one that we have is community outreach and employee engagement. So this is one that we created specifically for Carilion. This was not based on HHI. And the reason that we did this was because primarily the previous work groups were focused on our facilities. And what we wanted was a work group that brought in our employees and our communities, something that brought them into the fold and into the planning from the very beginning. So the next step is to organize and prioritize the work, and that's where we are right now. So what we're doing is we're taking the HHI framework goals and objectives for our facilities, and we're incorporating programs, intentionally incorporating programs to improve community health and collaboration, to make sure that we are intentionally working with organizations outside of us in order to build community relationships, form community collaboration, and address environmental health issues.
So as Sarah said, we both have healthier hospital initiatives and Carilion Clinic goals. So for healthier foods, for healthier hospital initiatives, their goals decrease meat purchases by 5% per year, increased meat purchases raised without antibiotics by 5% per year, and increase the percentage of local and sustainable food purchases by 5% per year in our cafes. In addition, we established the Carilion Clinic Local Food Program. To kick off this program, we signed the Healthy Food and Healthcare Pledge by Healthcare Without Harm that commits us to offering healthier, local, fresh, sustainable food in our cafes. We also started a farm table outside of Roanoke Memorial Hospital, our flagship hospital. This farm table allows community members, visitors, patients, family members to shop and bring local foods as they're entering and exiting our hospital. And then we also established a farm share program, which is a community supported agriculture or CSA program. We work with a farm collaborative out of Floyd, which has over 80 different farmers and growers. And essentially, we pay upfront at the beginning of the season a lump amount for our farmers to grow a share for us. And what makes this program very unique, we utilize payroll deduction for our employees to make that initial purchase very easy for the employee. Since this program started in 2013, we have sold $143,000 worth of farm shares. All of that money goes directly to the farmers, it stays in our communities, and it supports local agriculture. We have also invested in our local farmers markets through the SNAP Double Value program. SNAP, formerly food stamps, is accepted throughout the region, and what we do is we provide grants to various farmers markets throughout Southwest Virginia to be able to double those SNAP dollars. We also support Happy Healthy Cooks, which is a program that teaches children how to enjoy and cook healthy foods. These programs are offered in underserved areas through TAP Head Start sites and elementary schools. We also fund the Roanoke Community Garden Association to provide education on how to grow fruits and vegetables in underserved areas of Roanoke. Finally, we partnered with Feeding America for their Veggie Mobile, and we offer screenings at these drop-off locations for free fruits and vegetables. One program I want to mention real quick that is not on the slide, we just piloted a fruit and vegetable prescription program. We call it Fresh Foods RX at one of our practices that participants receive weekly health education, and then they receive a voucher or a prescription for healthy foods that they then cash in at the local farmers market that is on site at the practice.
So our next challenge area was less waste. Our HHI goals were to reduce regulated medical waste to less than 3 pounds per adjusted patient day and achieve a 15% recycling rate, which we're happy to say we've already accomplished. As far as folding in the community, we worked with Habitat for Humanity when we implemented a recycling program. We sorted out our aluminum. Habitat comes on site, they haul it off for us, and then when they recycle that, they use those funds to build homes for low-income families. The other thing that we have done is taken all of these massive pockets of excess, clean, usable product that would otherwise go into the waste stream, i.e. if we had a conversion or if we switched vendors or if there's a surgeon who wants a new or needs a new tool. Instead of those items going into the waste stream, we donate them now to the international mission field, to people going on international missions, or to one of our medical education institutes like our medical school, our PA school, our nursing school, or of course our sim lab within the facility. Leaner energy, our goal is to reduce greenhouse gas emissions by by 3%, 5%, and then 10%. And the way that we're wrapping in the community is we're working with the director of the Virginia Tech School of Green Engineering to develop a carbon footprint calculator for our facilities. And we're also installing a 7.5-acre solar tracking array to be installed in spring of the coming year at Carilion River Valley Medical Center, which is our second largest hospital. Safer chemicals, our goals will be to use 90% Green Seal or Eco-Logo certified cleaning products and to eliminate DEHP or PVC from one product line. And the way that we want to fold the community in with this is to work with to explore campaign options with the Greater Roanoke Valley Asthma and Air Quality Coalition. They have some really great insight into what we need to look at within our facilities and outside of our facilities. Employee engagement. So while leadership engagement is key, the next step is we have to have our employees engaged, and we have to have them have their support in order to get this work accomplished. So one of the best things that we've done in the last year is to really cultivate a spirit of sustainability. We've got 51 sustainability champions in our largest hospital from multiple nursing units, from multiple departments. We have an annual Earth Day event where we will be giving out tree saplings to employees, to patients, to visitors, to the community. And then, of course, we have a nonprofit, the Clean Valley Council, that does an annual river cleanup. Our Roanoke Memorial Hospital sits right on the Roanoke River, and we want to encourage people employees to engage in that to help with that annual river cleanup. Another community outreach program that we work with is Lead Safe Roanoke. That's a grant-funded program designed to reduce lead poisoning in children aged 5 and under by stabilizing lead-based paint hazards found in homes. Funds are available to help stabilize those homes for low-income families, and the way that we at Carilion want to help them is by linking this organization with our emergency physicians and our pediatric physicians, so that when they identify a low-income family or a patient that's at risk and that could really benefit from these funds, we can provide them with that information. The biggest thing that we've done for our leadership and community outreach engagement is we had a sustainability tour after we signed the Healthier Hospitals Executive Commitment Statement. And we invited local area business leaders in from many, many different areas to share our sustainability initiatives. And our hope is that moving forward, they will invite us into their facilities so we can keep the conversation going. So what's unique about this program is a couple of things. Number one is the level of engagement and enthusiasm that we're getting from people on all levels. Our employees love it, our leadership love it, the community loves it. Everybody is really excited that we're doing some work in this area and that we're acknowledging that this is something important. The other thing is that it links very facility-based work, being checking our energy and our waste reduction, and it intentionally wraps in community campaigns to hit it from both sides. We'd be remiss to not acknowledge the challenges that are the same with everything else. Time, human resource capabilities, budgetary constraints, but this is where it really helps to have the top-down approach that we used. So in closing, this is why we do it. This is our Roanoke campus, this is our medical school, this is our community. Environmental health and community health are inextricably linked. If we ignore the health of the environment and we dismiss the importance of environmental sustainability, we will miss a very important piece of the puzzle that provides us with the complete picture of community health, and we will fall short of fulfilling our mission to improve the health of the communities we serve. We at Carilion are excited by this program, we're excited by the potential of this program, and we're eager to work with our community partners to create a more robust and comprehensive program.